Hi, my name is Kenneth Liu. I'm a neurosurgeon at Bronson. I'm the director of Neuroendovascular Surgery. I think it's important to remember that when somebody has a stroke, it's essentially permanent and irreversible. When you lose part of your brain, that brain's not coming back. And I think a lot of patients don't understand how devastating that can be until it happens. And so I think stroke prevention is very important. It involves not smoking cigarettes and involves eating as healthily as you can. It involves working with your family physician to make sure your blood pressure, your blood sugars, your cholesterol are all where they're supposed to be. Some of the most pressing priorities for stroke care in the Asian American and other Islander community really revolve around education. I think it's very important to learn what the symptoms of stroke are, to understand that it's not something that you can sit on or wait for it to go away or see if it gets better or worse, that you really need to call 911 immediately. For certain types of stroke, there are incidents in the Asian American or the Asian populations are higher than in Caucasian populations. For instance, plaque, for whatever reason, tends to build up inside of the brain at a much higher rate than it does in people of European descent. I think there are a lot of things that can impact the healthcare experience of patients in the AAPI community. There are a humongous number of different ethnicities, different languages, different cultures from the Asian continent. There are probably a lot of differences in terms of cultural attitudes, particularly towards medicine or seeking care. I think a lot of more traditional Asian American or Pacific Islander patients, they may not be used to speaking to doctors or having or being told what to do and what not to do. 25 years ago, stroke care was very, very different. Stroke has gone from a nothing to do disease to a medical emergency to now a surgical emergency. So there are certain kinds of stroke where if you can get to the hospital quickly enough, we have surgical procedures that can restore blood flow in a timely fashion and essentially reverse or prevent some of the devastating consequences of stroke. Care really starts with the patient or the family knowing what the symptoms of stroke are and calling 911 and getting the patient to the hospital as quickly as they can.